for the greater good. Right now, we're going to introduce some speakers who are going to be talking about some things that we as leaders and community activists and advocates for those who are underserved need to be watching out for at the State House. There is a call for us, we believe, to be mindful of what is happening as far as legislation, laws, and all of those things affect us as individuals and also affect those whom we serve. And so we want to be mindful of what's happening right there down in Indianapolis in that big state house where people are making decisions. And we want to have an impact to the degree that we can so that we can help people in that way as well. So without further ado, I am going to bring up, is Tony here? Yes, there is Tony. Tony Gillespie. He is a vice president. I'm going to mess up his title. Wait a minute. He's the vice president of public policy engagement for Indiana Minority Health Coalition. Vice president of public policy engagement for Indiana Minority Health Coalition. For those who have been here in these meetings on multiple occasions, you have heard me talk about IMHC and our partnership with IMHC. A couple of months ago, we had the CEO give a history and background of how IMHC came to be. That is an important organization, a coalition statewide, and Tony works with that group. And he's going to talk a little bit about his role with IMHC and give us some, some highlights and an overview of some things we need to be looking out for. Tony?
Good morning. Thank you so much for having me. I don't know about anybody else, but I'm growing really weary of Zoom calls. It's great to see everybody, but this is madness. The number of Zoom calls that you have in a day, and I share with my colleagues at IMHC, it's illogical to think that we can do 5 and 6 Zoom calls a day. We never had 5 or 6 meetings a day, so we're working 3 times harder than we did before. And while I'm not opposed to hard work, I'm tired of Zoom though.
Well, thank you, Tony. Despite your weariness, you have come to be with us today.
Absolutely, because this work is important. So that's my disclaimer and my gripe. I am the vice president of policy, public policy and engagement, and that's just a glorified title for advocacy. The most important thing that we as community leaders, as grassroots organizations, as grass tops, the most important thing that we can do in terms of addressing concerns at the community level and communicating with our elected officials is the education piece of it. We have to be advocates, and we have to be able to articulate and tell the story of what the issue is in our community. And if there's a piece of legislation that's proposed, is it going to help or is it going to hurt? One of the things that I absolutely abhor is for a bill to be passed, and then 3 years later, we're passing another bill to fix the first bill that we passed. That's just madness to me. There's no risk if you come from a community-based organization, a nonprofit. You are not lobbying when you educate a legislator on your position on a piece of legislation and how it will either help or hurt. You're not a lobbyist. You do not run the risk of losing your 501c3. And so part of our mission, at least from my perspective, part of our mission for nonprofit organizations, nonprofit doesn't mean that you don't need to make a profit, but I think it does give us some special allowances, but for me, it's mission driven. We are the ones we have to be able to educate our legislators. And so on the Democratic side, Phil Gianquinta is your representative for Allen County, and he is great to work with, very accessible. And I'd just like to make a suggestion that maybe somewhere during session, if you can carve out 5 or 10 minutes for him to come on and give a really high level update of what's going on at the State House, I think he would welcome that. He's great to work with. As a matter of fact, I'll reach out to him. He's great to work with. I think some of the other elected officials from the Allen County area. They're all great people. Um, I think the one legislator that I've had the most interesting relationship with is Liz Brown. Um, but we've kind of figured out a way that we can work together. I'll give a short version of this story. There was a piece of legislation that was originated in the Senate where we were seeking Medicaid reimbursement for doula services. And doulas, we have a doula program in South Bend, and the idea is that we want to launch more doula programs in parts of the state with um, higher residency of Black and Brown women. Because doula services have been, it's evidence-based, it's been proven to have significant outcomes, improving birth and health outcomes for Black and Brown pregnant moms. And Liz Brown asked a question because there was a perception that the doulas were trying to be interlopers or replace some part or some piece of the medical team. And we had someone who testified, and she got kind of, got tangled up in the words, and so Liz Brown voted against it. Um, so a few weeks later, it came up again in appropriations because even though Liz voted against it, it passed. It came up a few weeks later in appropriations, and it was a 9 o'clock meeting. And I thought, oh, I'm not going to bring somebody from South Bend to testify on something for 10 minutes. I can do it myself. So I studied up on it, and I got all of my talking points. And honestly, I didn't think Liz Brown was on that committee. So I was in the hallway, taking a nap, really, waiting for this committee meeting started. I heard her voice, and I thought, oh my gosh, she's going to tear me up. And when I went to testify, she, was hunkered down in her big leather chair. And as soon as they said, Tony Gillespie, Indiana Minority Health Coalition, she sat up and she turned her mic on. I thought, oh my gosh, she's going to tear me up. But she just really had questions that she just needed some clarification on a few things. And once we were able to develop an exchange, and I told her what was and what wasn't, that a doula is not part of a medical team, but a doula is a support, that there were male doulas, female doulas, postpartum doulas, full spectrum, doulas have specialty training, but they are not clinicians, and they're not intended to replace anyone on the clinical team. They're there for mom, and they enhance the clinical team. And so not only did she understand and she voted in support of the legislation that day, she was the one who defended it on the floor once it went for full Senate approval. So it's important for us as advocates to send the right person with the right message, but we have to educate our legislators. If we don't educate them and they pass some funky law that does the wrong thing in the community, if we didn't try to address it, then that's our fault. That's just the way I see it. So in terms of current legislation, and Sharon, what I'll do is I'll send you IMHC's public policy agenda, our policy agenda, and then the Legislative Black Caucus, Indiana Legislative Black Caucus has an extensive social justice and minority health agenda as well that I'll send. There are a whole slew of bills. Bills that we are supporting are, we're targeting more on infant and maternal mortality. So there's a bill from State Representative Vanessa Summers that addresses implicit bias. And I think that's now come up again in a very different way with the passing of Dr. Susan Moore at IU Health over the last few weeks. There's another piece of legislation to secure doula reimbursement from Medicaid, because the bill that passed, it passed, but it didn't pass with a budget. So it's like it's not passing. And there's just still a lack of clarity on how doulas will access that reimbursement. Bills to put a cap on insulin cost in Indiana, because around the country we are at epidemic proportion in terms of diabetes. Last year they passed a piece of legislation that I didn't necessarily agree with, a piece of legislation that made it legal for people who are living with diabetes to be able to purchase some of those insulins, different types of insulins over the counter. As a diabetic and a diabetic that doesn't do the greatest job at managing it, the idea of purchasing insulin that my doctor didn't prescribe terrifies me. But it passed, and everybody thinks it's great. I just think that's one of those things. 3 years from now, we're going to have legislation to fix it. So there's a capping of insulin costs. There's police reform legislation. But for IMHC, I think the most, or we think are important and impactful. It's the ones that address infant mortality are the ones that are priorities this session. Indiana has never done a good job with infant mortality. And so my analysis is Indiana is always at the top of the bad list and the bottom of the good list. So we're never anywhere in the middle in terms of our public health. There's legislation to increase our public health investment. Indiana is one of, so if we're looking at the top list, we're at the top of the list for lack of public health dollar investment. If it's the good list, we're at the bottom of the list for states and their public health investment. And so primarily, most of our dollars are the federal dollars that are used through the state agencies as pass through. That's usually the State Department of Health, or they changed their name and they were DOH now, Department of Health. And then there's a lot of lack of clarity with the CARES Act dollars, exactly what's going to be done with that. So while I think there are a lot of challenges with this session, I think there are a lot of opportunities that we should look for and that we should stay in touch with our legislators so they can keep us abreast of what's happening there. So yesterday, I think Representative Summers' bill on implicit bias training was heard. It got its first reading. So at least it got assigned to a committee because there was some rumor that the Republicans weren't going to hear a lot of the Democratic bills. Just rumor swirling. Vanessa Summers ended up COVID positive. Speaker of the House, Todd Houston, ended up COVID positive. And so a few other legislators are living with COVID. And so there was some thought of they would discontinue session and just have one meeting a week. And, so it's a lot going on with our legislature. And it's really important that even though we might not be able to physically be there, because once we found out that there was a no mask mandate, meaning that legislators didn't have to wear masks at the State House, my agency, IMHC, made the decision that we were going to be primarily virtualized, that we would not go into the State House. The first day I was there, it just felt odd to be at a state facility and people were just walking around like they were in Florida with no mask on. So it was just odd. So we're going to virtualize, and we're just watching all the legislation closely. I can babble all day about this, Sharon. So you have to tell me when to shut up.
Okay, so real quick before we go on to the tobacco tax, wasn't there, or do you know the status on Vanessa's bill about the shackling of pregnant inmates? I think that's House HB 1430.
Right now, it doesn't have a hearing date.
Can you tell them briefly what that is, what the bill is?
Well, you just did, for sure. Piece of legislation. Indiana is one of the few states that still allow for pregnant women who are incarcerated to be shackled during exam or even during birth, during delivery. So this bill will eliminate that. And it was one that Vanessa initially filed it, but I think now it's being carried by I can see her face, the new legislator out of Grant County. I think she's carrying it now, but it's absolutely, we support the legislation. So what I can do is I'll send you the latest bill track, and keep in mind that thousands of bills that have, once we get to this point during the legislative session, there are thousands of bills that have been passed, and what we try to do is go through it and pick out the ones that we are either adamant in support or adamant in adamant and not supporting it. There are still some bills that come along that we don't support. One bill that has come back every year for the last 4 years is a bill that will lower the age of juveniles um, to be prosecuted as adults, which is troubling because then, in terms of juveniles, that's largely that would disproportionately impact minorities. That would be Black and brown juveniles who absolutely, if they committed a crime, they should pay for it. But then you will have an 11-year-old and an adult male prison, and the psychology behind that is that that if 11-year-old goes into an adult prison and all of the horrors that they experience in prison, they will never be able to be rehabilitated, and to go back into their community and be a participating part of the community. So there are a lot of pieces of legislation that may be well intended, but when you really begin to look at the impact and the disproportionate impact and who it will affect and who it won't, those are just things that we have to be knowledgeable of.
Tony, thank you so much for pausing your ban on virtual meetings.
Well, if I want to have a job, my ban is just lip service. So
okay, thank you so much. And
if there are any questions, I love to answer any questions if there are any.
Are there? Dr. Overton says they have removed the shackles when I asked them to. So she is an OBGYN. And Laura, you say that the shackles have been moved when you asked them to, the authorities to do so?
Yeah, and I've not had that many patients that were in shackles or in jail, but typically they have a woman come with them, of course, and even to physical exams for their, OBGYN exams. I will ask them to remove the shackles and for the warden or whatever to leave the room, and they do. They just stand outside.
And you're absolutely right. In previous career, I worked for Healthy Start. I'm originally from the Gary area, and I worked with the Healthy Start program. And when they brought the women in from the county jail for their OBGYN visit, they would remove the shackles. But that was only if we had a clinician that asked. Otherwise, they didn't. And
exactly.
not all clinicians ask. And by law, even if you ask, they don't have to.
Yeah.
So there are multiple states have, they vilified that. They don't do it anymore. And over the last few years, you hear horror stories of women who were shackled to their cot, and they were, because they don't really, not all prison facilities have that kind of space, or they don't have space for delivery in the infirmary. So between the time that they can get the woman to a hospital and have her cared for there, they end up putting her in isolation, and she's shackled to her cot. And so we just want to see the shackling practice removed. But
yeah.
Thank you.
I agree, because you're not a woman, but it's already an indignity to have those kind of exams. Right. And then you just add fuel to the fire by putting someone in chains and forcing them to take off their clothes and invade their body. So I just, yeah.
Yeah. So in our OB clinic back in Hammond, Indiana, when we knew they were coming, we would, schedule other patients. And so when they did come, it was nobody else there. And my boss, who was a nurse practitioner, she said, remove the shackles. I don't want them shackled in this clinic space. This is a sacred space, and they are to be honored here. Remove the shackles, don't even bring them in. And first couple of times they didn't do it, but afterwards they did. So you're right. Thank you. Thank you for that, though. Thank you.
Thank you, Laura. And I'm going to ask, does anyone else have one more question perhaps for Tony? If so, you can just unmute yourself. If any other questions arise, Tony, we will get those to you. We thank you so much for coming and joining us today. I look forward to getting the list from you of some of the highlights that IMHC is going to, are backing, and that we can take a closer look at and see if we want to back those as well. I'm sure we do. There's, like you said, there are so many pieces of legislation that are being proposed. And so it helps for us to get kind of some highlights of things that we can look into. Thank you so much. I know you have to go on to another meeting. So we thank you for coming.
Thank you for having me. And thank you for maintaining this group. The Allen County Health Disparity Coalition has been a force for years. And so just thank you for doing this. Not all communities do this. So thank you to everyone for your continued participation here. Thank you.
Thank you. Thank you.
Bye-bye.
Bye-bye. And so group, we move on right now to Nancy Kripe. You all know Nancy. She is a member of the coalition, and Nancy, of course, is the executive director for TFAC, Tobacco Free Allen County. And she's going to talk a little bit about the legislation that proposes an increase on the tobacco tax. Nancy?
Thank you so much, Sharon. I'm so thrilled to see so many people here today, so I get a chance to kind of bring you all in on this topic, which is really exciting. So let me bring up my slides. Let me make sure I've got sound on because I've got a video clip. Of course, now I'm trying to get it to move. Okay, I think I do. I moved it down out of the screen. There we go. Get that. And oh, all these different ribbons. It's hard to, there we go. Hard to get to my, from beginning. There we go. Okay, so what we're advocating for and what other health and tobacco control advocates across the state are advocating for is a $2 per pack increase in the cigarette tax. The reason for that being that Indiana has one of the lowest taxes on cigarettes in the country. It's not the absolute lowest, but we're way down towards the bottom. And we have even lower than all of the other states surrounding us, including Kentucky, which, as you know, is a very major tobacco growing state. Their cigarette tax is higher than ours now. So we really are behind the times in terms of this. And the main reason really for doing this is that when you raise the cigarette tax, this is a proven measure across the world, not even just across the United States, that higher cigarette taxing lowers the smoking rate. I mean, it just goes hand in glove. It's like you make it much more difficult for young people to start, for anyone who's living kind of on a marginally financially, make it harder for them to smoke. It increases their motivation to quit. Now, we know from surveys that like 70% of smokers actually say they want to quit. So this is a way of kind of adding on to that motivation. It's like if you're saying you're wanting to quit, of course it's hard because it's an addiction. You got to ask for help. People have a hard time doing that. But, the more you take away the making it easy to smoke. So when we pass smoke-free air laws, when we add cigarette taxes, anything that we can do that makes it more difficult to smoke, that helps people actually do what they really want to do, which is quit. So we're really advocating for a $2 increase. There is a bill that's been introduced to increase it by $1. So we want to see that raised. It can be amended. I mean, it doesn't have to. It's not set in stone that it has to be $1. So that's what we're going to be advocating. The message to lawmakers should just be increase it by $2. I want to play a clip from Raise It for Health, which is our statewide coalition of health-focused and tobacco control-focused organizations that are advocating for this. They put together a new, actually a set of new videos this fall, or for this season, this session, that are really good on this topic. So if I can get this to link, and I think I can, I want to play, this is their website, which I want you to be aware of. First of all, is Raise It for Health. It's just raiseitforhealthin.com. So Raise It for Health Indiana, raiseitforhealthin.com. And the video I want to play is this one, the last one on the page.
Let's state the obvious. Smoking is bad for Indiana. It is largely responsible for our poor health rankings and claims the lives of 11,000 users each year.
Oh.
Is anybody else seeing the video or?
Okay, let me try something. I may have needed to, let me try resharing. I may have missed a command here. Optimize for video clip. Let me try that. See if that makes a difference. That's aggravating. I thought I had it. Darn it. Okay, you're seeing my screen now, right?
Right, it just went black.
Why did that happen? Your screen sharing is paused. Why? Try one more time here.
Okay.
Your screen sharing. Okay. So it's when interesting. It's when I go to the link.
Yeah.
Okay, anybody know why that happens?
If you have the link, copy that and put it in the chat box, then you can click it there and it might work there.
Ah, okay. We'll try that. Chat box, okay. Well, this will give everyone the link if nothing else. But that's really aggravating. I thought I had it.
Okay. It's in the chat.
Do you see it now? Because I clicked on it.
Oh, no.
All right, let's try again. Share screen. You know what? Okay, let's try this. How about now?
Yes.
Yes.
Okay.
Yes.
I just did it directly rather than doing it from my slideshow. So I guess that's what I have to do. But that shouldn't be the case. But okay, let's try this video now.
Let's state the obvious. Smoking is bad for Indiana. It is largely responsible for our poor health rankings and claims the lives of 11,000 Hoosiers each year. But hidden behind the rankings and the staggering loss of life is a bigger, darker story. While all Hoosiers struggle under the weight of smoking's impact, certain communities suffer more than others. Lower income, minority, and rural communities are intentionally targeted by tobacco companies. Tobacco companies add an additional burden to thousands of families already under pressure from financial stress, mental health challenges, and low access to resources. In places where health and wellness are fragile and in need of support, Big Tobacco spends more on advertising, lowers prices on cigarettes, and aggressively markets products aimed at getting young people hooked. Those efforts generate enormous profit for these companies, while costing us our health and economy. While cessation programs and education are important, they are only part of the solution. A $2 increase in the tobacco tax is proven to reduce smoking rates. Lower-income Hoosiers are more likely to quit as a result, leading to healthier families, longer lives, and more money for things that matter. It's in our character to care for one another. Our hospitality is well known. We want to be a place where all people can thrive, and smoking shouldn't stand in our way. Together, we can overcome the burden of smoking. Together, we can build a healthier, better Indiana.
Okay, thank you for whoever gave me that suggestion of putting it in the chat. That was great. So let me go back now to my slide because I had a couple other slides that I wanted to show you. So what we're asking people to do is, oh, why did it go there? There is contact your legislators. And so, like I said, there's actually, let me go ahead to a slide here and I'll show you. There are 4 bills that have been introduced into this session that have to do with tobacco in some way. There's a couple of Senate bills. One of them is on prohibiting flavorings in e-liquids, which is also a good bill to support. And then there's one on age verification for tobacco and vaping sales. The House Bill 1076 is another one on flavorings. This one's better than the Senate bill because it actually is saying banning flavorings in all tobacco products, e-liquids and every other tobacco product, which we definitely support. That's another one that we'd ask for you to, you know, express your support for to your legislators. But the one that deals with the tax is House Bill 1434, which is...
Nancy, I'm sorry. Please mute if you have not muted yourself. Someone is coming through. If you've not muted yourself, please mute your audio. Thank you. Sorry.
No, thanks, because I was hearing that too. It's like, it's hard to keep a track of my own thoughts when I'm hearing somebody else's voice. House Bill 1434 is the one that's currently raising both a $1 increase on per pack on cigarettes, and then also, this is also a good thing, raising the tax or actually adding a tax on e-liquids. There has not been to this point an excise tax on e-liquids. So it's a double good thing, this bill, in that they're wanting to do both of those taxes at the same time. So that's what's been introduced. But the key thing at this point, they've been read in the House. They've been referred to the Committee on Public Policy and the Committee on Public Health, respectively. And at this point, no other further action has been taken yet. So part of what's important, not every bill that gets referred to a committee actually gets heard by that committee and acted on by that committee. So it's really important to have the public's voice out there saying to your legislators, we want this, get that voice out there so that they actually say, hey, this is an important bill for us to act on. And there is support for it. So I wanted to show you, if you don't already know, how to find your legislator. And I hope this link works. We'll see. See if I lose my screen sharing now. Please move this window away from the shared application. Oh, that might be the problem. It didn't. Okay, so I'll have to do it the other way because I do have it up, I believe.
Nancy, we can provide that link in our follow-up email.
The advantage to me doing it, okay, I think you can see it here, is I can show you where to go, which is really helpful. So are you seeing the Indiana General Assembly page now?
Yes.
Okay, so on here, it says underneath the slideshow that you see, the main frame here, find your legislator. When you click on that, why is that not working? Okay, there, sorry, at the bottom of the picture. Then you get this screen where you just put in your address, you do your search, and it will bring up both your representative and your senator. So that's a great way to do it. And then you can link to their page. You can link to a link where you can actually email them directly or get their phone number and call them. So this is a really great way to find how to connect with your legislator and also to follow legislation. So when I look on here under legislation, I can actually look by subject. That's how I got those bills that I showed you. I can go legislation by subject and then go down and you find like cigarettes, cigars, and tobacco cigarette tax. That's how I found it. So I found it really helpful when somebody introduced me to how to use this website, how to kind of navigate it and find how to contact your legislator. So I wanted to show you that. So let me stop that, go back. I have one more slide I wanted to share with you. It keeps taking me to the wrong one. I don't know why it does that. It's not the one I selected. Here we go. So the other thing is just to follow us on Facebook, Tobacco Free Allen County, and also Raise It for Health. They have a Facebook page, so that will keep you updated on, where are we at with the bills, what action has been taken. If we give call outs to say, hey, we really need calls right now because say maybe it's being heard today in committee and we really need people calling in so that it really gets the attention that it needs. Sometimes they propose amendments that don't make any sense. So we need people to voice that. So follow us so you'll know what actions we're asking folks to do. And the other thing, the last thing I wanted to say is please join us also. We need more people on our coalition. So we're advocating not just for state level policy, but also locally to make comprehensive smoke-free air, a thing throughout the county, to add e-cigarettes to our local ordinance, to work on cessation, doing everything we can to combat tobacco use. So if that's an issue that, speaks to you, you've got people you care about who smoke, or you just care about making us a healthier place to live, which I know everybody on this call does, right? Because it's a health coalition. So we'd love to have you also on our coalition. So thank you, Sharon, for having us, and stay tuned for more information on the cigarette tax.
And Nancy, you guys meet on the second Wednesday of the month?
Yes, thank you. Yes, the second Wednesday of the month at noon. And we usually post that on our Facebook page, so you can find, reminders of that, or you can email me. If you can maybe send out my email, maybe with the minutes from this meeting, that would be helpful. And then people could contact me if they are interested, and I can send out the link, because I don't like to post the link on the Facebook page just because we don't want, we kind of want to control who shows up and who doesn't, so we don't get harassed.
Quick question here, Nancy. Great presentation, Dr. Kane says, but also a question from Dr. Overton. Does this apply to smokeless tobacco?
The tax does not. Not at this point. That's another whole issue that we really need to tax all tobacco products more heavily. They tend to focus on the cigarette tax, I think, just because that is the most widely used product and the one that causes the greatest amount of harm. But really, they all need to be taxed heavier and do everything we can to discourage their use. And their use by youth. That was a slip of the tongue there that was probably meaningful.
All right.
So thank you for having me.
Thank you, Nancy. Moving along, and again, we are going to share some of the information that you have provided us with today. Thank you for that great overview. Now, does everyone see my screen? Hello?
Yes. 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 Yes.
Okay, so you can see my screen. It says Health Visions Midwest.
Yes.
Okay, so I am going to go through a presentation here very quickly, telling you guys a little bit more about Health Visions. I know that many of you have been involved with Coalition for some time, but some of you have not. And so I wanted to, and we as a team wanted to talk a little bit about what we do to make sure that you know some of the things that we do outside of the Coalition. Okay, so who are we? Health Visions Midwest is a faith-based nonprofit organization sponsored by the Poor Handmaids of Jesus Christ. And our vision is to empower and support people to live healthier lives. You know, for those of you who have joined us in the virtual age, you may not recognize all of our faces in those little squares. So this is who we are. Gabby Lemos, who is our Latino community health worker and medical interpreter. Carlos Harrison, who is an administrative assistant and CHW as well. Can everybody mute? I can hear that back talk. And then there's me and Peggy, who is our senior community health worker. What you may not realize is that Health Visions Midwest has 3 locations. We are not a sole entity. So there are other Health Visions Midwest locations in Indiana and East St. Louis. So we have a location in Hammond and in East St. Louis. And each location serves the specific needs of the surrounding community. Paula Wills, who is based in East St. Louis, is our executive director. Now, the things that we do based on a CHW or community health worker model. So that's here in Fort Wayne. Our staff are CHWs who serve the community as liaisons, so to speak. And that means that we build necessary relationships within the community. We build relationships with residents as well as community partners. We are a liaison, I mentioned, between the people in the community and the resources that many of them need. Many of you know what a CHW is, so I won't go too deeply into that. But CHWs have various skills that can be adapted to different work environments and different needs that corporations and organizations have. You know, they're active listeners, they're problem solvers, facilitators, communicators, and they are knowledgeable about different health information that people need, resources where we can help them, resources in the community that can help people to fulfill the needs that they have and fill different voids that they may have in their lives. So traditionally, some of the things that Health Visions Midwest has done, we've done health education for some time. We've been a partner with IMHC for many years. And by health education, I mean that we do different presentations, classes, and workshops. And many of those deal with nutrition, obesity, mental health, chronic conditions that plague underserved communities, chronic conditions such as diabetes, high blood pressure, and all of those things. So last year, in the 2019-2020 fiscal year, we served 1,000 people in the primarily in the Southeast community through health education workshops and classes. We also served 200 or more people through Spanish medical interpretation with Gabby Lemos. She did that all by herself. She is a medical interpreter, and she went to different hospitals and clinics and did that. Health fairs. We have partnered with many of you, providing health fairs throughout the community. And in that year, we, through those health fairs, there were almost 3,000 health-related procedures that were done on residents. And of course, we've done, holiday baskets and various partnerships like with Francine's Mobile to provide that service within the community. Now, during the pandemic, of course, just like all of you or many of you, we've had to expand and do some different types of services. And that has included, with the health education, I wanted to spotlight that we've done so much more mental health education, dealing with anxiety and depression. Why have we done that? Well, we've done that because that's what the people have needed and asked for. During this pandemic, so many people are having to find new ways to cope, mechanisms to deal with the anxiety that they're feeling. And so our CHWs have done, from April to December, they did 342 presentations on depression and anxiety. That's, more than twice the previous rate for these types of talks. And that's, of course, in addition to some of the other health education that was provided. We also branched out into doing more food distribution in partnerships with Food Rescue United US and local churches. Our CHWs were out in the community partnering to distribute food baskets to people in need, because that has become an even greater need, with people needing food, not having enough to eat. Food insecurity, of course, has been on the rise during the pandemic. We collaborated with the IMHC and some other groups to do COVID testing, and we're now doing some vaccine messaging, or aiding the state and these groups in their vaccine messaging efforts. Of course, we've done Heal Farm Markets. That was something that we also did starting new with the pandemic. And Heal Farm Markets are markets that are set up in food deserts so that we can be of service to people who don't necessarily have the transportation or the means to get food. Again, food being an issue. We also started doing transportation in a partnership with CTN, helping people to get to medical appointments and grocery trips. And Spanish interpretations have expanded. The need for those have expanded not only to medical appointments, but also to practical things that people need. Gabby, are you on right now? I know she was having a conflict with an interpretation. Gabby, are you there?
No, I'm here.
Okay. Tell people a little bit about some of the needs with regard to Spanish interpretations that have changed.
Like you said, before it was only medical interpretations, but after COVID, people started calling for me to register their kids to online. So registration to school, I know they have help, but if they know the people who they trust, or if they see the people in the community, they're most likely to call them. So I received a lot of calls for that. Then I did an immigration interpretation. We had to sign this paper. We went to Indianapolis and in front of the immigration person and everything. So I have done that too. And then people just to apply for services. I know I can refer them to somebody else, but they're like, can you help me please? Like, I believe the trust that they already have to Health Visions, that's what they come back to ask to help them, not only on the medical interpretation, but as well as other interpretations that we can do. I don't do court. I've been requested, but because I haven't been certified, so I don't do court and translations or interpretations, but I refer them to people who I know they can help them. I don't know, simple things like calling to make appointments, not only to Clinica, because we partnership with Clinica Madre de Dios, which is a free clinic every Wednesday at St. Patrick's Church. But Matthew 25, we go to Matthew 25 a lot. Parkview Hospital, they do provide medical interpretation or medical interpreters, but they have to request, the patient has to request the medical interpreter. And sometimes they just don't get it, or they like to have somebody face-to-face instead of phone, because face-to-face, they just feel that they feel taught, they get the message better face-to-face instead of phone. So other things that we have done, like I said, Comfort School, doctor's appointments, medical interpretations at Clinica, Matthew 25, and other clinics like Women's Health Advantage, Lutheran Hospital. So the interpretations is been increasing, and there's only one person in the office.
We got Gabby working hard here, but thank you so much, Gabby, for that overview. I think it's important for us to understand the needs of the Latino community, as well as other communities of color, African American community, and some Burmese, in the Burmese community as well. And those needs have been, exacerbated by the pandemic. And we need to be mindful of those services that are necessary out there to help them as well. So these are just some pictures of some things that we've done, expanding the services. To the left, that's one of our food drives. In the middle, that is our Thanksgiving basket giveaway. And on the right, that's our intern, Felicia Keller, who's no longer with us, helping out with the Heal Farm Markets. A new program that we initiated late last year is called NEAP, the Nutrition Education and Access Program. And basically what we've done is we've combined some of the practices, some of the services that we've had for some time, such as health education. We've combined that with incentives and some new incentives. So we've traditionally done incentives in terms of giving out $5 gift cards for people who earn that after going to one of our health education classes. We also now offer transportation to grocery stores and to medical appointments. So we combined all of those things and have called it the Nutrition Education and Access Program. We also give food vouchers to Community Harvest. And so how this works is people, they gain the knowledge, the tools that they need to live healthier lives. That's what we're all about. We want to empower people and give them tools to live healthier lives. They gain that knowledge through the presentations, the classes, and the workshops. And once they do that, then we give them the incentive, which is, a gift card that they can use to purchase some of the healthy foods that they've learned about in the workshop, and the transportation that they need to make it to medical appointments and to the grocery store, because some live in food desert communities and may not have that transportation. We can't do any of this, of course, without our community partners, who are people like you, leaders who work with us to, increase our impact in the community. And so we've had community partners that, run the gamut. Right here to the left is a picture of us packing up some coats that we got from Come As You Are Community Church and distributing those in the community. For the free COVID testing and antibody testing that we did over the summer, we partnered with the Urban League. We partnered with Fort Wayne Housing Authority and the State Department of Health. With our Heal Farm Markets, our sponsors for those markets are, St. Joe Community Health Foundation and Parkview Health. We also partnered with Purdue University, Fort Wayne in managing those markets. And of course, because of the pandemic, we are now more inclined to do a lot of virtual education. And so that's how, just like you guys, we have switched to some more virtual opportunities, webinars, Facebook and partners allow us to do that. So we've given a webinar about COVID and violence in the community with IMHC. We've done an educational session with community health workers statewide. We have done a Facebook Live with Logos Baptist District Association about diabetes. Please mute someone. And then, we've also done things with other media outlets, Side Effects Public Media. Hey. Who is that? Y'all hear me? We did a Facebook Live with Side Effects Public Media, and that was a Spanish-speaking event. Preguntas sobre COVID-19. I'm not sure. I know preguntas is a question. And so those are the things that we are doing now during the pandemic. These are some of our sponsors and grantors here. And of course, the Allen County Health Disparity Coalition, we oversee and facilitate. And we are grateful to be doing that. And so one of the things that we want to do is we are going to do a survey to find out more about what you all need and want this year. We've been doing the Allen County Health Disparity Coalition for a number of years now, and want to keep it relevant and up to date with things that are happening in our community. And so we're going to be sending out a survey about that. Is Renetta still on the line? I know she had to leave. Renetta, are you there? Okay, so Renetta's not here. She's not with us any longer. She was here in the meeting a little bit earlier, but the Allen County Health Disparity Coalition has a long history in the community, and it has done some great things. They've done some research and gathered together for bills to rally the legislature and as advocates for different measures and things along that line in years past. And so what we want to do, like I said, was we want to keep it relevant. And Carla, are you there to talk a little bit about the survey that we have for the coalition to take?
Yes. Good morning, everyone. Health Vision has created a 5-minute survey in SurveyMonkey, and it consists of 10 questions. We will be sending the link out later today. And the purpose of this survey is to get your feedback. We want to know what you're thinking, which in turn will help us to improve. So please complete the survey by Friday, February 12th, and we will be sharing the results at a later meeting. And if you have any questions, please don't hesitate to contact us at our office at 260-745-1600. Thank you.
All righty. So that was that. Do we have any questions about Health Visions Midwest, the survey, or anything along that nature? By the way, I did send out my monthly newsletter, and so that should be hitting your it should have hit your inbox yesterday, late yesterday. And in that, we talk a little bit about some of the things that we mentioned today with the survey. Any questions? Well, I guess I must have just really spelled it all out there for you then, okay? Okay, I'm looking in the chat box here. Am I missing anything, Peggy, Carla?
Yeah, you're good.
Sharon, it's Laura.
Okay, go ahead, Laura.
Sorry, my voice, I don't know where it went. I put in the chat box a link to our next prenatal and infant care webinar because it's really relevant to everyone. Obviously on the phone, we're talking about the maternal mortality review, and it really has great health disparities. It addresses mental health and all the issues that are surrounding our pregnant women and families and new families at the moment. So anyway, I gave you information on it, when it is, and then the link if you want to register for it.
I'm not seeing the link, Laura. This is
it not way at the bottom? See the HTTP? I'll post it again.
Okay. Yeah,
it's
Laura,
also on our newsletter.
I don't see any link either.
Okay.
So what am I seeing here? Katie, you're asking me if I can resend the email, the newsletter? Okay, so Carla, can we make sure that we get that to Katie, the newsletter? Perhaps we need to forward it and check and see if she's in our SALSA Engage database. Please let us know if you're not receiving our newsletter, in our correspondence, so that we can make sure that you are in the link. You are in the link so that you can stay in the know. Anything else from our partners? Any other partner news? We usually reserve, we say 11:15 so that we can have the last 15 minutes for networking and partner news. Anybody have anything that they want to share? Thank you, Laura, for the infant mortality information. Anyone else?
I do. Rachel from Shepherd's Hand. Hi, everybody. Good to be with you. So here at Shepherd's Hand, we have a couple events coming up that I will be sending Carla flyers for just as soon as I can get all the info together. I'll be sending that her way, but just a couple dates for you. We are having our first blood drive with the American Red Cross on Saturday, February 6th. That's from 9 to 3. And so we're trying to get the word out, and all of you probably have heard by now from other Red Cross events about the COVID antibody testing and different incentives that they're trying to encourage people about how that can be extra helpful nowadays. So we're hoping to get at least 25 people. I know we have at least one sign up in myself, so please feel free to spread the word and join us that day if you are a blood donor. We are having our first health fair of the year on Saturday, February 20th. Sharon, I will be getting in touch with you regarding that. You reminded me of some things, so we'll be in touch, but that is from 11 to 2 on Saturday, February 20th. And those who have joined us for those events will know that we have both exhibitors from a couple different community health organizations. Some of you on this call, I think, have been exhibitors with us. We do have very limited space. So if you're interested in that and we don't have space this time around, please reach out to me and I'll put you on our list for the future as well. But as part of that event, we also give away free diapers through our diaper bank. And lately, I do want to put a plug out there too, that if your group, your church group, your friend group, your employer, wherever wants to partner with an organization in collecting something tangible to help the community. We've had some great partners recently from Zeta Phi Beta. The ladies have done 2 different drives for us. The General Motors African Ancestry Network folks and the Women's Committee out there at GM they really came through too, did another drive for us, as well as the Fort Wayne Parks and Rec Community Center group. So we have a number of different partners. If your group wants to get on that bandwagon and join us, we need partners to be able to have enough diapers to have these health fairs, because the diapers really are a big draw for families, especially now in COVID, who are facing need even more than usual. So those are our biggest events going on. And then I will just mention that our after school tutoring on Tuesdays from 3 to 5 is still going on. We are a small group, so we can socially distance, but especially with all of the online school stuff, we've found that some families are really struggling to keep it together even more than usual with helping their kids and balancing all the things. So if you know a family who might benefit from just having some one-on-one help even once a week, please have them get in touch with me and we'll see about getting them in. So
thank you so much, Rachel, for keeping us up to date on what's going on with Shepherd's Hand. I'm glad that you mentioned partnerships. In our newsletter, we talk about the power of partnerships. And so that's one of the reasons why we're here, so we can come together and work as a team and and partner with one another. So if you have any idea about, partnering with organizations for diapers for the Shepherd's Hand Drive, please do so. If you have any ideas to partner with us in the various ways that we partnership, please let us know. We've got some things in the chat, some announcements, so please read up on that. Joellen with Covering Kids and Families of Bright Point, and she's talking about they're doing in-person appointments now at their main office downtown. So take a look at that, and she's got some contact information there, her phone number and email. Katie Murray with Neighborhood Health, they've just opened a vaccine clinic. People 70 up now can make their appointment, and that is that at all of your locations, Katie? I know you say you're doing rapid testing at the Southeast office, but for the vaccinations, can they come downtown?
Yes, so both of our sites are on the on that website right there. So we are doing the vaccinations at our Calhoun office 4 days of the week. So that is Monday, Tuesday, Thursday, and Friday between 8 and 5. And then we're doing vaccinations at our Southeast office on Wednesdays. which I also believe is 8 to 5 as well.
Okay, wonderful. And like Katie is saying in the chat, if you have not heard, they're going to be going to the old Ward Education Center and have that as a community resource. So they are rehabbing that old Ward, LC Ward school and turning that into a clinic. Katie, question that I had, are you all making that an additional location, additional site, or are you actually closing the Calhoun site and moving there?
Oh, no, it will be additional. So yes, so we are keeping our Calhoun, which is our main office, and we will also be keeping Southeast. So I don't think as of right now, there's any actual set plans on what we're going to offer at Ward. Everything is still in the planning stages, but I do know that it is going to be a year-long project, and we're hoping by the end of the year that we will have everything in place.
Wonderful. So we are getting some great resources in the Southeast area as far as health. We've got this coming. We already have the Paulding neighborhood health site. You're doing some rehab for the Ward School. What street is that on? I forget. I see it in my mind, but
it's on Warsaw Street, and it's actually just a few blocks from the Brownlee Market.
Okay, it's right there from Brownlee's. And then, of course, you all probably also heard that we have Alliance Health that's set up in our community as well at the old Lafayette Medical Center. Any other news that we need to hear from our partners?
Just real quick, just a shout out that, you know, our mobile food pantry, we have dedicated sites for the entire year, every Tuesday and Thursday from 11 to 1. Today, we will be at Autumn Woods, where we distribute culturally appropriate food. The beautiful thing about this is for anyone that you all serve is they can come to as many or all of these if they want. It's a drive-through and they need absolutely no ID to do this. So we have regulars, we know them by name. We also bring masks, some home-sewn masks. We're finishing up that initiative, trying to use up the rest of those dollars. So they might also leave with masks too. So don't forget about that. And with the relaxing I did of our food bank rules, if you will, or procedures a year ago, I'm just going to keep those in place. We'll serve anyone at our food bank here on site on Broadway once a month, as long as they have one form of ID and proof of residency. So I had someone message me this morning on Facebook saying, hey, I just moved from Huntington. All I've got is a Huntington address. That's fine. We will serve anyone. Before it wasn't like that. So you need ID when you come here on site, but you leave with a huge cart of groceries. Or you can also do the mobile food sites where, I mean, we give you a lot of groceries, but not like you would here, and you don't need ID. So we try to be accommodative. We are in Waynedale this year. We're out north at DuPont Estates, where a lot of those trailer park communities are. And we have a huge following on our social media. So if you know of anyone in need, and we will do pop-up sites. We do have a big presence out Southeast. Come As You Are is a dedicated site now because the need is great there. We've been at the League for the Blind 3 times, I think, last year. It was huge turnout. So the need's not going to go away. I was just talking to my food bank director this morning that, you know, the New York Times and the Post and everything is just reporting how the food lines are getting longer and longer around the country. And that is definitely what we're seeing here. So send everyone you can to us. We will help them.
Melissa, are you putting these pop-up sites and things going on your Facebook page?
I actually have it pinned to the top, what our dedicated schedule is. It's on our website. I did a press release a while back. We've had some press turnout for it because, you know, people want to know, right?
Right. I ask that because, you know, that's an easy way that we as a coalition can share that information.
Sure.
We like the Wellspring Facebook page, and then simply can share some of those events coming up. We can do that with Shepherd's Hand. We can do that with Neighborhood Health. When these events and news items are coming up, we can simply click the share button and share those things on our page. Are you all still coming to the Pontiac Library as well?
Yeah, we'll be here for the rest of the year. That site has really grown.
We see y'all out there.
Yeah. So no, that's a location we don't want to leave because it's taken a while. Some of these sites, it just takes a while for people to like trust us and know. And I've worked really hard in building our relationship with Community Harvest too. We're offering less junk food. I want more healthy options, right? So, and then produce, we always give away as available or what we can purchase. I just, Carmen and I work pretty closely together from Community Harvest, and we just kind of expect the need to keep going up and the supplies to go down. So, but send everyone, we'll give them whatever we can. And you know what, Sharon, I can, I'll send that schedule to you. And then you can share it with the whole group if you'd like.
Okay, we could do some of those things. Thank you. Anybody else we got what, 4 more minutes. Anybody else have something they want to let us know about real quick?
This
Maya.
is Maya. Hi. I just wanted to piggyback off of what Melissa was saying. I mean, they've been doing such an awesome job with their mobile pantries. We also have a farm wagon distribution. So if anyone on the call isn't already familiar, I can send that, actually the schedule to you. But one of the things we're looking at right now is reaching people who either don't have transportation or are medically homebound due to quarantine. We've been talking to some other food banks that have piloted some home delivery programs. We're looking at a way to either expand on existing efforts or implement something new. I've been talking to Ann at CTN, Fort Wayne Community Schools, and I just reached out to Katie at Neighborhood Health to kind of identify those places where people are either, getting a positive diagnosis and having to quarantine, but they don't have food. So anyone with ideas on, how to identify or quantify that need, I'd love to hear from you. I'm going to go ahead and put my email in the chat. But yeah, so we've got some things in motion.
Wonderful. And this, these are all things that we may need to put in our newsletter. Maybe y'all will start reading it then. If we, all the stuff in there. But one thing that we want to do is we want to, have a way for us to know what each other is doing. And so, the more we get these events and things that are going on from our partners, we definitely want to include those in an upcoming newsletter and compile them all together so that you can see what's happening throughout the community. We do have something in the chat from Imani Services. Imani Services is partnering up with Wellspring for a pop-up event at Adams Elementary School to provide PPE and food for families. Wonderful. Thank you, Melissa. Denise, you had something?
Yeah, this is Denise. I thought I was retired, but they called me back. I'm now the live-in community builder for River's Edge, which is a supportive housing program on Spy Run. These could be families, they could be vets, they could be people who were previously homeless. A lot of them have had mental health issues, and we basically need everything. So I'm going to put my email in the chat because I need to redevelop my database. I was retired. I didn't think I had to reach out that much to it. But please, thank you for those that have already reached out to me, Maya, Sharon, Peggy, and things of that nature. We were able to give these folks the first Christmas that they have ever had in a facility such as this. But I'm trying to put together a whole program for 2021, 22, and so forth like that. So I will put the email in there, and I hope to hear from you all soon. Thank you.
All right, thanks so much. And then we've got Lee Galani giving us a link to President Biden's executive order today.
Yes, we just received an executive order regarding the Affordable Care Act, where he is going to be opening up the marketplace again for open enrollment, which is normally November 1st through December 15th, which was 45 days shorter than the previous administration. And he's opening up the open enrollment till starting February 15th through May the 15th.
Thank you so much, Lee. Thank you. We appreciate that update. And so like I said, we got all these things in the chat. I appreciate you guys for participating today. This is great. Usually you all don't have anything to say when I say, do you have any news? But I guess, you know, the start of the year, you got some gumption and you're telling us what is actually happening in your organizations. So thank you so much for joining us today. We appreciate each of you. We are always willing and ready to partner with you, and we want you to partner with one another. So Carla and I will be sending out an email with the survey that we've talked about and with some of the information that has been discussed today. At some later time, we may be putting some of the different events that and services that you mentioned in our upcoming newsletter. Any more words to close out? All right. Thank you so much for joining us with the Allen County Health Disparity Coalition. And if you take the survey, you'll see that we're asking what you think about that name, because we may change the name. So we want to hear your input on that. Thank you so much. And we will see you next month. Bye.
Bye-bye.
Bye.